Let's dive a little further in here. Another concerning factor up here in the north, especially in this past decade, is definitely healthcare. Northern health is an absolute mess at this moment. We've got hospital closures 4 and 5 days sometimes. I see you posting about it quite often on Facebook over there in Mackenzie and in Fort St. John. Maternity ward closures now hitting Prince George. That was a real red flag for me. Small communities, we've seen them have these closures and things for a very long time. It's not good. It shouldn't happen, but that kind of has been the norm. Seeing Prince George get hit with one of these shutdowns was pretty eye-opening for me, too. I actually have a personal insight that shows how broken this system is just from a real base level, too. I have a cyst, a very simple cyst that I got about 3 years ago. I've been on a wait list for a cyst removal for 3 straight years. There's no end in sight for a cyst removal. I've asked if I can be referred to a different health authority. There's all this paperwork and red tape involved in that, even though there's spaces out there. It's just an absolute mess out there right now. So what do you know of the issue, and how do we fix this thing?
Well, access to our healthcare system is one of the biggest challenges right now. People are frustrated. They languish on wait lists, and the wait lists are actually longer than people let on. As just the example that you provided, how many people are just not bothering to go to get an issue dealt with because they don't want to deal with the system.
Yep.
So we have a massive problem. Mackenzie, just July and August here, they've had 19 ER closures in Mackenzie alone. And that's, now we're seeing more closures in Burns Lake and Fort St. James. Quesnel recently, an even bigger center, has seen closures the last month.
Yeah.
And then Prince George seeing that maternity announcement. Fortunately, in that case, the wasn't necessarily from Northern Health or provincial government stepping in. It was the local doctors stepping in, physicians, to find a solution to keep the lights on for now. But it's really tough for those healthcare professionals who are working in the system. They're trying to do whatever they can. It's not their fault. It's actually systemic problems. So obviously there's been years of under recruitment of nurses and doctors. The Mackenzie example, it's actually a nursing shortage in Mackenzie. That's the biggest issue there.
Yeah.
But physician shortages are also part of it. But right now we haven't built a system where the efficiencies are in there, so those that are in the system are not being used and working towards the things that actually matter. They're forced to do so much administrative overhead that how much of your time are you actually spending nursing or caring for patients as a physician? There's a lot of pushing paper around. Right now, we also have a major, across health authority, this isn't just Northern Health, but across all health authorities, there's a major administrative burden with bureaucracy that's just blown out of control.
Yeah.
We have 73 vice presidents across our health authorities in BC. Alberta, about the same population as BC, just under. They've got 8 vice presidents. I'm not saying Alberta has the right number, but at the same time, there's obviously waste in the system when we're not focused on that frontline care. We're focused on how it works for the system, not for the patient. So what we need to look at for the future is making sure that, finding ways for money to actually follow the patients, making sure that patients have choices in the system. The case that you have, Matt, you should be able to walk to or travel to another location if need be. If they have availability, you should be able to get in there, no problem. There needs to be some tools in the system to make it actually work for people, not to languish on wait lists, because ultimately that leads to even worse problems. When a senior can't get a hip surgery, they're actually it turns into many other health problems that the healthcare system needs to deal with. Right now at UHNBC, about a third of the beds are actually taken up by patients that should be in long-term care. So these seniors are actually living at the hospital. That is not dignified for seniors who spent their entire lives working hard, and then we have them living in the hospital, sometimes in the hallway. That is completely unacceptable, and it's the system breakdown. It's not just a money thing. It's not part of that's the only thing. It's how the money's being used.
Yeah, yeah, 100%. Ben Meisner, I don't know if you knew Dr. Bert Kelly, who was the regional head here in Prince George for Northern BC for many years. I don't know. Do you remember the big health rally that went down in 2000 here in Prince George?
Yeah, I've heard lots about it, and I wonder what, when we're going to be at that point where we're getting to that type of a conversation, certainly, because the call back then was, "Have you had enough yet?" And I think people are getting to that breaking point where
Yeah,
they've had enough. They want to see the system improve. They want to see people actually, have timely access to a family doctor, to surgical care, to an ER where you're not waiting 6, 7, 8 hours. Northern Health doesn't actually post the ER wait times because some other health authorities do,
yeah.
but they don't because it's just not something that anybody wants publicized because it's that bad in the system right now.
That's right. Yeah. Yeah, I mean, I think we're there. I think we've hit break
I
glass
agree. Yeah,
moments now with our healthcare. And I think there's a few pieces we need. I think there's a few things that original event had that made it successful. Number one, Dr. Charles Jago. You had an educational side to that, and he was tied into UNBC. Ben Meisner was the most powerful voice in the North at the time and had a lot of connections to get that word out there too. And then you had somebody in the healthcare that was willing to be a little bit of a whistleblower and a little bit of a cheerleader at the same time in Bert Kelly. I think we have the political voice with yourself, with Rosalind, with Sheldon Clare, with a few other people that are speaking on this in the North. I think we need a media and we need a healthcare voice. So if you know somebody in healthcare, and we can chat about this offline, I'd love to do some rallying around the North here a little bit too. I travel the whole northern half of the province and have no problem when I'm up there in Fort St. John or Fort Nelson or whatever, rolling into a couple of locations and getting some people on board with this. So we'll talk offline too. If you've got some
no, that's
connections on the inside of this, I think this is something that we could start on. I think it's time.
100%, Matt. And I appreciate what you said about Ben Meiser being one of your mentors, and he's probably educated you on how this all went down. So that's pretty great that yeah, you've got that passion for it as well. It's going to take a lot of us to actually come together to sound the alarm and actually get some big changes to happen. And we're at that point. You're absolutely right that things need to change now. People can't stay in this position and our healthcare professionals need us right now too. They're struggling. We've seen. I've tried to call out in the legislature the violence in hospitals that have
Yeah,
happened. There was one day in question period. I asked the premier if he'd be okay if someone walked into his office with a crossbow, because that's actually what happened in a hospital. Nurses having to deal with things like that, completely unacceptable. We can't have violence, and we can't have our healthcare professionals subjected to that type of behavior, and it's making the system even more challenged because they don't want to go to work the next day.
100%. I was just chatting with a friend about that yesterday. She had to take her daughter into the ER just a couple nights ago, and she said they ended up just leaving because it seemed more dangerous to sit there in the ER with the people that were there than it was to wait to see a doctor for up to 4 hours. So yeah, I mean, we could beat on this one all day long. My last question on this and my last point, it's great that all of a sudden the government is announcing $2 billion or whatever it is for this new health tower that we have coming to Prince George. But what drives me nuts is you guys have done nothing. The NDP has done nothing to fix the administration and system problems that we have in Northern Health. We can't even staff the building and the space we have now. And now you want to put $1 billion into a news release and say that this is going to fix the problem? No, you've been doing this the whole time. You've been putting more nurses and more doctors into the meat grinder that is your system that's broken, and then saying, oh, we just need more. We just need more. No, we need more efficiency. I think that's what we need at the end of the day, and Northern Health seems to be the least of that at the moment. But
Well, that's the worry, Matt, that we build a big tower and it sits empty because we don't have the staff. So that's something that my very first meeting with the CEO and the chair of Northern Health, we talked about that path, HR path to get ready for it. We also need the system just to work more effectively. This should be a tertiary healthcare center for the entire North, not sending people down to Vancouver. That's partly why within the Northern Health system, people have called for a helipad to be included in the patient care tower. The NDP promised it right during the election, and yet we still don't have any details on when that what that looks like. So again, something else we've been calling for. We don't need to be sending people to Vancouver. We should actually be sending people in the north here at Prince George, so we can centralize services here, so that we can actually get the care people need here. We need cardiac care. We're the only health authority in the province that doesn't have cardiac care. We need proper supports for patients here in the north. Having to fly to the Lower Mainland, clogging up the hospitals down there is part of what's adding a lot of the cost to the system actually as well. It's not, we need to actually have some regional accountability and regional support here for those who need it.